The provisional agenda for this meeting is Peace and Security in Africa, Ebola.
The impact of the Ebola virus disease is unprecedented in medical history. Ebola is now a threat to global health and also a rare subject of discussion at the UN Security Council. According to a United Nations report, there are over 2,000 Ebola-related deaths in West Africa. The rising number of new infections has taken the virus to epidemic proportions in the region. Secretary General Ban Ki-moon already sees a need for the UN to spearhead the intervention to provide medical and financial aid to the affected countries.
The Ebola crisis has evolved into a complex emergency with a significant political, social, economic, humanitarian, and security dimensions. The suffering and spillover effects in the region and beyond demand the attention of the entire world. Ebola matters to us all.
Without a dramatic shift in the scale of our response, the number of infected individuals is projected to double every 3 weeks. Looking away will not make this go away. One of the main reasons this outbreak has spread so dramatically is because up to now, we haven't come together sufficiently to confront it.
This global concern on Ebola is certainly a relief to countries like Liberia, Sierra Leone and Guinea, who are the worst hit by the deadly virus and grappling with an inefficient healthcare and social welfare system that doesn't provide adequate support for infected persons.
This is not just an outbreak. This is not just a public health crisis. This is a social crisis, a humanitarian crisis, an economic crisis, and a threat to national security well beyond the outbreak zones.
The gravity and the scale of this emergency calls for speed, coordination, and innovative responses. This is no ordinary crisis. It is a global wake-up call about an invisible enemy that we hardly know.
The outbreak has grown to over 5,000 cases, resulting in over 2,000 deaths. Medical research shows that half of these cases were diagnosed in just the past 3 weeks, and there could be as many as 10,000 cases by September 24. This obviously is the reason why the Security Council's draft resolution on Ebola was unanimously adopted. It had the most co-sponsors ever in the history of the United Nations. This shows the growing global concern at the frightening spread of the viral disease in West Africa. Femi Akonde, TVC News, New York.